Every 11 seconds, an older adult is treated in an emergency room for a fall related injury. Every 19 minutes, an older adult dies from a fall. Falls are the leading cause of both fatal and non fatal injuries in adults over 65. And the risk increases dramatically with every decade after that. But here is what almost nobody tells you: the research on fall prevention is actually very clear. There is one category of exercise that outperforms everything else: walking programs, strength training, and medication reviews combined. When it comes to reducing fall risk in adults over 70, most people are not doing it. Most doctors are not prescribing it. By the end of this video, you will know exactly what it is, why it works at the neurological level, and a precise protocol you can start this week. Let me put some numbers on this first because the scale matters. According to the Centers for Disease Control, approximately 1 in 4 adults over 65 falls each year. After 70, that rate climbs. After 80, it climbs further. Roughly 20% of falls cause serious injuries, hip fractures, head injuries, or wrist fractures. Hip fractures, in particular, carry a sobering statistic. Within 1 year of a hip fracture, approximately 20 to 30% of older adults die from related complications. But beyond the physical injury, falls trigger something called the post fall syndrome, a cycle of fear, reduced activity, further deconditioning, and increased fall risk that can permanently reduce independence even when the physical injury heals. Understanding how to interrupt this cycle before a fall happens is not just about injury prevention, it is about preserving quality of life and independence in the years ahead. If you have spoken to a doctor about fall prevention, you have probably been told one or more of the following: remove trip hazards at home, install grab bars in the bathroom, review your medications, and do some gentle walking or strength exercises. All of these are reasonable. None of them is wrong, but the research tells us that none of them individually comes close to the effect size that one specific type of exercise produces. And that exercise is almost never the headline recommendation in a typical clinical encounter. A landmark systematic review and meta analysis published in the British Medical Journal, known as the Cochrane Falls Prevention Review, analyzed 159 randomized controlled trials involving over 79,000 participants. Now, this is one of the most comprehensive evidence reviews in all of geriatric medicine. The finding was clear: exercise that specifically challenges balance and requires the body to stabilize itself under conditions of instability is by far the most effective single intervention for reducing both the rate of falls and the number of people who fall. Not strength training alone, and not walking, not medication review, balance challenging exercise. And the effect sizes in the highest quality trials are remarkable, some showing 40 to 55% reductions in fall rate in older adults who participate in structured balance training programs. To understand why balance training is so much more effective than other interventions, we need to look at what actually causes most falls in older adults. The majority of falls do not happen because someone is simply weak. They happen because of a failure in the neuromuscular system, the communication between the nervous system and the muscles, specifically in the fraction of a second after an unexpected perturbation. A perturbation is any sudden disruption to balance: a slight trip, an uneven surface, a moment of dizziness, a sudden turn of the head. The question is not whether these perturbations happen, they always will. The question is whether your nervous system can respond fast enough and with enough coordinated muscle activation to recover before you fall. This recovery response depends on three overlapping systems working in coordination: the vestibular system in your inner ear sensing position and movement, the proprioceptive system in your joints and muscles sending position data to the brain, and the cerebellum processing all of this and firing the corrective motor response. When any one of these systems degrades, and all three tend to degrade with age, the window of time available to recover from a perturbation narrows. Balance training directly targets the integration of all three systems. It forces the brain and body to practice exactly the perturbation response cycle that determines whether a stumble becomes a fall or becomes a recovered step. Let me walk through what the evidence actually shows at the level of specific interventions. Tai Chi is the single most studied balance training modality for fall prevention in older adults. A meta analysis of 18 randomized controlled trials found that Tai Chi practice reduced fall risk by approximately 43% compared to control groups. The mechanism is well understood. Tai Chi requires continuous slow weight shifting, single leg stance, rotational movements, and coordinated breathing, all of which directly train the vestibular and proprioceptive systems while maintaining enough cognitive engagement to prevent automation of the movements. The Otago exercise program, developed specifically for fall prevention in older adults and tested in multiple large trials, produces fall rate reductions of 35 to 40%. It consists of a structured set of leg strengthening exercises combined with balance exercises that progressively increase in difficulty over weeks. Single leg balance training, simply practicing standing on one leg with progressive reduction of support, has shown significant reductions in fall risk in multiple trials and is the most accessible starting point for most people. The FAME program, fitness and mobility exercise, combining balance, strength, and aerobic training in a specific sequence, showed fall rate reductions of up to 55% in adults over 70 in Canadian trials. What all of these programs share is that they create unstable, challenging conditions that require the nervous system to actively work to maintain balance. That active neural work is the training stimulus. Exercises that do not challenge balance, seated leg exercises, machine based strength training, flat surface walking, do not produce the same neuromuscular adaptation. Based on the research, effective balance training for fall prevention in adults over 70 rests on four pillars. Understanding these pillars helps you evaluate any program and build your own. Pillar 1, reduced base of support. Walking normally gives you a wide, stable base with both feet on the ground. Balance training progressively narrows this base. Fight together, tandem stance with one foot directly in front of the other, and ultimately single leg stance. Each step along this progression challenges the stabilizing systems more. Pillar 2, reduced or altered sensory input. Your balance system uses three input channels: vision, vestibular, and proprioception. Balance training that removes or reduces one of these channels forces the other two to compensate and improve. Examples: eyes closed balance, standing on a foam pad, which reduces proprioceptive precision, head movements during balance that challenge the vestibular system. Pillar 3, perturbation training. This involves deliberate, controlled practice of recovery from balance disruptions, stepping over objects, responding to unexpected pushes in a supervised setting, walking on uneven surfaces. This specifically trains the rapid neuromuscular response that prevents a stumble becoming a fall. Pillar 4, progressive overload. As with resistance training, balance training must become progressively more challenging over time for adaptation to continue. If the exercises stop feeling difficult, they stop providing a training stimulus. Progression must be built into the program. And of all the programs I have mentioned, the Otago exercise program is the one I want to spend more time on because it is the most accessible, has the strongest evidence base specifically for home based fall prevention and has been tested in the oldest age groups, including adults in their 80s and 90s. The Otago program was developed by researchers at the University of Otago in New Zealand and has been tested in multiple randomized controlled trials. The landmark trial by Campbell et al. Showed a 35% reduction in falls and a 30% reduction in fall related injuries in adults over 80, completing the program at home. The program has two components. The first is a series of leg strengthening exercises, knee extensions, hip abductions, calf raises, and toe raises, typically performed with ankle weights that progressively increase in resistance over weeks. The second is a progression of balance exercises, walking heel to toe, walking and turning, walking backwards, one leg standing, and stair walking. The balance exercises are performed holding a support, initially and progressively reducing support as confidence and ability improve. It is designed to be done 3 times per week at home with a 30-minute walk twice per week on separate days. The research shows benefits begin to appear after approximately 4 weeks and continue to build through the first year of practice. Tai Chi deserves specific attention because the evidence behind it for fall prevention is among the strongest of any single exercise modality in older adults. The mechanism of benefit in Tai Chi is multi layered. The slow, deliberate weight shifting trains proprioceptive sensitivity in the ankles and hips, the joints most critical for balance recovery, the rotational upper body movements, combined with lower body stability, train the ability to manage rotational perturbations, one of the most common fall triggers when people turn their heads or reach for something. The cognitive engagement required to learn and perform the sequences provides dual task training, exactly the kind of combined physical cognitive challenge we discussed in the last video on walking speed. And the breathing and meditative elements have been shown to reduce fear of falling, which itself is a fall risk factor through the muscle tension and movement restriction it causes. A large review published in the Journal of the American Geriatric Society analyzed Tai Chi specifically for fall prevention and found that programs of at least 12 weeks duration, with sessions of at least 60 minutes twice per week, showed consistent and significant reductions in fall risk. The review recommended Tai Chi as a first line recommendation for fall prevention in community dwelling older adults. You do not need to find an in person class immediately. Chair based Tai Chi programs for beginners, available online and on YouTube, provide meaningful starting points for adults with limited mobility. The key is starting and building progressive challenge. Before we get to the practical protocol, I want to address something that does not get enough attention in fall prevention discussions: the fear of falling itself. Research consistently shows that fear of falling is present in 40 to 70% of older adults, including many who have never actually fallen. Fear of falling leads to activity restriction, which leads to deconditioning of exactly the balance and strength systems that prevent falls. It is a self fulfilling cycle. Fear leads to less movement leads to more physical decline leads to more actual fall risk, which increases fear. Balance training is one of the most effective interventions for fear of falling, precisely because it builds the actual competence that reduces the fear. Studies have consistently shown that older adults who complete structured balance training programs report significant reductions in fear of falling alongside the physical improvements. This is why the psychological component is not separate from the physical component. They are the same intervention working on both levels simultaneously. Here's your practical starting point based on the best available evidence. Week 1 and 2, foundation. Exercise 1, single leg standing, hold a counter or sturdy chair. Lift one foot slightly off the ground. Hold for 10 seconds. Repeat 5 times each side, twice daily. This is your baseline. Exercise 2, tandem standing. Place one foot directly in front of the other. Heel of front foot touching toes of back foot. Hold for 10 seconds. Repeat 5 times each side, once daily. Exercise 3, sit to stand without using hands. From a standard chair, cross arms over chest, and stand up without pushing off with your hands. If this is not yet possible, use fingertip support on chair arms and reduce it progressively. 10 repetitions, twice daily. This is both strength and balance combined. Week 3 and 4, progression. Reduce hand support on single leg standing to fingertips only. Add eyes closed single leg standing for 5 seconds with fingertip support. Add tandem walking, 10 steps, heel to toe, along a line on the floor. Week 5 and 6, challenge. Attempt single leg standing without support for 5 to 10 seconds. Add head turns during tandem walking. Add stepping over low objects placed on the floor. Ongoing, at least twice per week. 30-minute walk on uneven surfaces, grass, a gentle path, slightly uneven ground, provides significantly more balanced training than a smooth, flat footpath. The irregular surface constantly activates proprioceptive feedback. This is the most underused and most accessible form of ongoing balance training available. 3 situations where you should seek professional guidance rather than starting independently. First, if you've already had a fall in the last 12 months, a structured falls risk assessment by a physiotherapist or falls prevention clinic is warranted. They can identify specific deficits in your balance system, whether vestibular, proprioceptive, or strength based, and target the program accordingly. Second, if you have a neurological condition affecting balance, Parkinson's disease, a history of stroke, peripheral neuropathy, or significant vestibular disorder, these require modified programs under professional supervision. Third, if your fear of falling is severe enough that you are already significantly restricting your activity, this level of fear often requires a graded exposure approach with professional support. Trying to start independently can sometimes reinforce avoidance rather than build confidence. For everyone else, healthy older adults over 70 who have not fallen but want to reduce their risk, starting the protocol I described is appropriate, safe, and well supported by the research. The evidence is very clear that the risks of inactivity and deconditioning far outweigh the very small risk of a supervised progressive balance program. As always, everything on health grounds is general educational information based on published research and is not medical advice for your specific situation. If you have a history of falls, balance disorders, neurological conditions, or significant joint pain, please work with your doctor or physiotherapist before starting any balance program. Coming up next on Health Grounds, the hydration mistake most seniors make, and what the research actually says about how much water adults over 60 genuinely need. It is not the 8 glasses a day you have heard your whole life. Subscribe so you do not miss it, and drop a comment below. Have you tried Tai Chi or the Otago program? I want to know. See you in the next one.